questions and to try to give some clarity to some of the confusion out there. It is one of our strong points, I think, is that we can try to communicate things, I think, pretty well, and sometimes take some of the complexity out of it. So, all like, you know, talking to when I used to do OB, when you or young mothers, there's no stupid question. If it's a question for you, then it's a question for somebody else. And it doesn't have to be uh, uh, limited to COVID questions. It could be any question. I will not give. I'm not. This is not a televisit where I'm taking on a personal question about an illness and doing a diagnosis and evaluation. But I will answer any questions the best I can, although we will not be giving specific advice to somebody, just general. So that's the, I guess, raise your hand. I'm not sure how people can ask questions. I'll first go over the questions that were submitted, and then open it up to just any questions that people may have. So there are 3 questions that, before I go on, is there anybody who have any questions or issues about etiquette during this session, or how-tos or problems with their
Scott,
connection?
I don't, I've used Zoom a lot. I don't see the raise your hand feature, but I know it's here somewhere. I just don't see it on mine.
Well, chat. You could go to
the chat
and put in a question, I guess, and then we can do it that way too.
Okay.
This is a very small group, so fortunately, with a small group, just speak up. And if someone is speaking, just wait till they're done before you ask your question, or put it in chat. So the first question I got I thought was really a good question because I had to go look it up, and that was, are all organs affected and infected with coronavirus? And then does that make them unavailable for donations like lens transplants and things like that? So the answer is yes. The coronavirus affects all organs, especially the lungs, and then the heart, and then the kidneys. And so those are, of course, major.
At 10:30, let's clean up. See how this works?
Yeah, we hear you, Jim. You're on. So yeah, I would say mute yourself, everybody, until you have a question to ask. So they were initially, blood transfusions were okay with COVID patients. Yeah, I'll say we hear some kitchen noise, so make sure everyone puts their, mutes their audio, please. But now they found the coronavirus in blood. They were able to grow it out of stool. So essentially, it's everywhere that has a ACE2 receptor, which is probably everywhere. And so I didn't get a real clear answer on this. There's 2 points. One is if you die of coronavirus, you have such multi-organ failure that your organs are not suitable for transplant. If you have tested positive, then you probably are available to give donations if the virus load has been cleared, and they would do the testing. Specifically, the eye, the lens. I doubt that tissue has ACE2 receptors in it, so that's probably okay. But for the most part, they're not. I don't think they're taking organ donations for people who have tested positive, and they are testing people. But it does affect your whole body. And then I'll pause, I think, after each question, just to be sure that no one pipes in with a secondary question to what I have said.
We just have another question in the chat room from Laura.
Okay.
It says, what do you say to people who don't think a homemade mask is worth the trouble or ineffective?
Well, I'm a blunt guy, and I say that's just not true. And the homemade mask is effective. And in fact, they have tested that. And so the surgical masks that you see are about 70% effective in blocking respiratory droplets. And if you look at, and they looked at other materials. So a T-shirt is about a 50% effective, and T-cloth is about 60% effective. So the other materials are clearly effective. They're not 100% effective, no, but will they reduce? They do two things. One, if you're far enough away, they'll protect you, and two, they do decrease your viral load. So there is some speculation that why do some people get sicker than others, and it may be just how much virus you get at one time. And so if you can decrease that viral load by 50%, you may have a milder infection or no infection, depending on your distancing and whatnot. So if you take if the masks and you look at how the fibers run, and let's say it's like a T-cloth and the fibers are running that way, and then you place another T-cloth perpendicular, you probably really increase the efficacy of the homemade mask in that kind of double layer fashion. And I don't think that's been tested, but I'm thinking that could be as close to a surgical mask. So again, it's effective, very effective, and so it's effective in not getting the disease. It's also really, really effective in not giving it to somebody else. And if 20% of the population is asymptomatic and passing on the virus, then you are protecting other people because you don't even know you're sick. So, and that's the big reason. We don't know who's sick, so wear the mask to protect others and protect yourself. So it's really, I think people who don't want to wear masks just are saying that because they don't want to wear masks. But and of course, the people were told early on that doesn't help. And why was that? It wasn't that it doesn't help. It was because we didn't have enough masks. So, and they wanted to preserve masks for healthcare workers because we were caught with our pants down and did not have the adequate supplies for the country. So it was very bad messaging. So hopefully that was clear. So another good question was, what's the duration or how long does it take for a typical non-critical case of COVID to last, and then a critical case? And so typically you get, if you have mild disease, you have symptoms for about 2 weeks. If you have severe disease, it's 4 to 6 weeks. And although there have been people on ventilators for over 3 weeks, so I would then imagine, after you get out of the ICU, it's another 6 weeks. So it can take, a while, but anywhere from, 2 weeks to 2 months, depending on how sick you are. Does somebody who has suffered a lot of symptoms, up to critical symptoms, have more antibodies than somebody who is asymptomatic? So I did not see data on that. Yes, we do make antibodies, and you make antibodies pretty quickly. We can detect them a couple weeks after you get sick. It's probably people who have critical disease have a exuberant immune response. So they not only have antibodies, but they have what they call cytokines and other inflammatory products, and they call it a cytokine storm. So it's not really clear whether it's the virus that is causing so much damage or harm, or the immune response to the virus in certain people that's causing this fulminant response. So, but yes, there is some, and that's why some of the medications that they're using are actually kind of anti-inflammatories. And nothing has been proven at all. Nothing has been proven at all in terms of treatment. But that was some of the reasoning behind using anti-inflammatories, is because of this exuberant inflammatory response. So yeah, I got a lot of antibodies floating around, and my guess is that there's more in critical disease, and that's part of the problem. And how long from exposure to, I guess, an exposure infection to contagious? So once you get exposed, you get symptoms anywhere from 2 days after exposure to 14 days after exposure. The average is somewhere between 4 and 5 days when people get their initial symptoms. You become infectious generally 1 to 3 days before your symptoms start. So depending on when you get your symptoms, you have to kind of then backtrack, well, when were you infectious? So if you were, started getting symptoms at day 4, then you were infectious anywhere from the first, second, or third day. And it's a little bit hard because the symptoms can be very mild, and some people are asymptomatic. So, and we don't have a lot of antibody testing to see, when people have been exposed, and enough RNA testing to see when people start showing it up in their blood. But generally, 1 to 3 days before your symptoms start, you are infectious. And again, seeing that 20-25% people are asymptomatic and don't have any symptoms at all, then it's a problem of you really can't tell when you are infectious, and that's why you wear your mask when you go out. So hopefully that was clear. As a corollary to that, when do you stop being infectious? And that's also really not known. And if you take the current recommendations, they say 7 days after your symptoms start, 7 days after your symptoms have started, 3 days after your fever is gone, that you can kind of come back to work. The problem is that they actually, depending on the studies, people have been shown to be infectious up to a month after getting symptoms. So it's probably on average 10 days after your symptoms started, you're no longer infectious, but the range is anywhere from 8 to 37 days according to different studies. So, that is problematic, and unless you really get tested. So if you're at home and you're isolating yourself from your family, how long do you isolate yourself? Well, it could go up to a month unless you get tested to see if you no longer are positive with a nasal swab. So that would be an advantage of doing a nasal swab, at 7 or 10 days, especially if you have someone who's sick at home and with immunosuppressed illness or something like that. So again, the trouble is that we really don't know a lot about this. I mean, for how much we know very little. We'll know a lot more in 6 months, I think. But right now, we don't know a lot about really how it acts and how it affects and who's at risk and all that type of stuff. It's lots of best guessing, and that's what's really confusing out there. So it will be very helpful, I think, when we get reliable testing. The testing is not 100% accurate, and there's a lot of false negative tests where the test is not should be positive but does not turn out positive, and there's a lot of room for improvement in how we're handling this problem.
I see Lana has her hand up, actually. Lana, did you have another follow-up question?
Yeah, it was me. It was me.
Okay.
Actually, I got two questions. Number one, when this thing started, there was seemed to be a lot of emphasis on receiving droplets both through your mouth, and that's why, or giving them through your mouth, but very little has been talked about your eyes. So is there a de-emphasis of receiving droplets through your eyes? And secondly, maybe I misunderstood, but can you have the virus and not be contagious?
Yes. So the first question with the eyes is, if someone sneezes on your eyes, and that is a portal of entry. If you touch a table or a banister or something on the stairs, or a shopping cart, and you rub your eyes, that's a portal of entry. So it's really a mucous membrane entry. So it's the mucous membrane of your mouth, your nose, and your eyes, and or you just inhale it as a droplet. So yes, the hand washing is partly to prevent you from taking it from your hands and putting it in your eyes or your mouth or your nose. My second question is, if you have a very mild disease, it depends on, you have to shed the virus. We call it viral shedding. So is it you have to be breathing it out, and that's the viral shedding for someone to get it. It requires a certain concentration of virus to infect somebody. So I would imagine if you have a very mild case and you're very, very low on your viral shedding, you probably are not contagious. I think it was like 10 to this, you need to have RNA viral particles 10 to the 6, which is 100,000 particles per some dimension. I don't know what it was. And less than that, you're not infected. You're not infective. So and this is why it's very difficult to sometimes know how long someone is infected, because they may still be positive, but they're not shedding enough virus to really infect somebody, or the virus could be sitting on a cardboard box and it's there, but it's not really intact enough to be infective. So it's hard to know, but I think probably yes. People who are very, very, very mild and are not shedding it, are not going to be infected. But very hard to tell who that would be. So I would not think, oh, I have a mild case, I'm not going to infect somebody. No. Unless you went into a laboratory and they actually counted the amount of viral particles coming out of your body, you would not know. So, which of course is not practical. Another question, go shoot, yeah. Mute, take you off your mute. Okay. You're still on mute.
Okay, just to follow on, and in respect to the eyes, there has been zero discussion about, is there anything the general population can do to protect the eyes as a portal? Does the wearing of any kind of glasses or sunglasses, or can you do anything at least to mitigate to some degree of receiving droplets through your eyes?
Yeah, glasses will work, but of course glasses have entry areas. So if eddies of air go around, they can go around the glasses. Now, if you go to the hospital, you will see people with goggles, and because if it's then sealed, then that's going to be the most protective. And, at our office, we have people wearing glasses with a face mask, which has a kind of a plastic shield, which is then going to decrease that. So it's clearly any barrier between the mucous membranes of your eye is going to work. But if it's an open barrier, it's not 100%. It's going to then be directional. So it depends on whether the virus coming straight ahead, sure. Coming around, no. But it's like a homemade mask. It will provide some protection. Again, you have to get, it's probably harder to get the disease from the eyes than from the, inhaling it in the nose. But it is possible. I think it's less likely, but so I don't think it's as a great of a risk as breathing this virus in right into your lungs, where you have most of the receptors, where the virus really has the greatest ability to enter the body is the lung tissue. So it's really what you're inhaling is the biggest risk, and that's why physical distancing is so important. And again, I'll just add on to that. So I don't see any other questions right now as we kind of close. But how far is far enough? And so it was 3 feet, then kind of 6 feet. But they've done studies in laboratories and have found that the virus actually, with a cough, can reach 27 feet. So are you able to be infected at 27 feet? Is there enough viral load at that distance? Well, don't know. 6 feet is working, and when you look at state statistics, the physical distancing has started to flatten the curve. I think that is very clear in Colorado, and which is good. So we're not going to overwhelm our hospitals, but it's bad because we prolong the season for infection. Because as you lower the curve, blunt the curve, you extend how long infection will last in terms of how many people will have it, new cases and whatnot. So, but the last I heard, so I think 6 feet's good. Although if someone's really coughing and hacking, I'd increase my distance, that's for sure. But for normal activities where people are just breathing, I think 6 feet is fine. For somebody who's coughing, I'd back away, get out of the room. So.
One more quick question. I think it's quick. I had the impression from what you were saying a little while ago that there's an amount of virus you may be infected with. And so some people may get a large dose of infection. Maybe some people don't quite get the same amount of virus, that they take in. But I was thinking, doesn't the virus multiply in your system, or you just get the amount you get, or what?
Oh, no, it multiplies. And so there's several issues there. How much do you get? Okay, where do you get it? So what tissue do you get it in? Is that tissue, what kind of barriers does that tissue have? And then how well can the virus get into the cells of that tissue? So if it's the skin, it's not going to go anywhere. But if it's the lung tissue, it's going to get in. Why? Is because there's receptors on your lung tissue cells called ACE2 receptors. And that's how the virus gets into the cell, by attaching to these ACE2 receptors. The lung tissue happens to have the most of them. Now, let's say, I have 2 times more ACE receptors than you do. Well, then the same viral load is going to be twice as infective to me than to you. So it depends on how many receptors you have, okay? And then when it gets into the cell, the virus will use your DNA and multiply like crazy. And then burst open the cell and throw out hundreds of thousands of new viruses in your body. And then it depends on, well, how quickly your immune system can gobble up those particles. So all those steps along the way is going to depend upon if you get infected and how sick you get. So the viral load is only one piece of that. Obviously, the more you get, the more cells are going to be infected, the more it replicates, the more that is going to challenge your immune system. If you get half the load, it takes time for that. That's why there's an incubation period. It takes time for that virus to replicate and divide. And in that time, depends on what your body, how many cells are doing that, and how is your body responding to that. So there's lots of factors why people get sick.
Are these receptors, what is the benefit, or is it beneficial to your body to have these receptors?
Oh yeah, they're the virus is just hijacking normal human function. So these are what they call angiotensin converting enzyme 2 receptors, and so they are essential to your body, your organ functions, and related a lot to your vascular system and how blood vessels open and close and things like that. So it just so happens, the virus happened to make that's what viruses are. I mean, they're just a protein, that has, mimicked something in the human body, and that allows it to enter and then, take over the DNA. And it just happened to, by evolution, has hit that receptor. Other viruses do different receptors, and other viruses do different cells. So really, viruses are constantly changing, and it's just like a crapshoot whether it's going to hit. Oh, that receptor works. Boom, I'm there, and then they establish themselves. And so yeah, it's evolution in process.
Well, thank you all for your questions. Are there any burning questions before we wrap up here? Okay.
So according to the most recent data, it looks like Colorado has probably peaked. But this data changes every day, but again, and there could be multiple peaks. So it really depends on what happens and what the government decides to do in the end of the month. But in terms of preventing further peaks, but it appears from hospital data that the hospitalizations are going down, cases are going down, so that we've probably peaked. Now the virus is still around, and it's really not a time to let down your guard by any means. I suspect this virus is going to be with us till the end of the year, for sure. Maybe for 2 years until there's a vaccine. So it's not really going to be a time this is a long haul. And so, maintain your vigilance.
Thank you, everyone, for your wonderful questions. We will do something like this every Friday, and if there's some folks interested, we can have another one with Dr. Hammond next Friday, and we'll do one with our pharmacist as well. So feel free to submit any questions for the next one, and we will be sure to answer them, or try to answer them.
And if you wish, give us some, if Stacy can send out a link of some sort to give us feedback on whether it was useful or how it could be more useful, or any ideas, things that that you would like discussed in further sessions and things like that. That would be helpful to make this something useful to you all, you guys.
Wonderful. And I see some chats coming in that says, "Thank you, Dr. Hammond." So
Oh, welcome.
All right, everyone, stay healthy and safe out there. Use those homemade masks.
Bye now.